my name is Justin Wong, and I'll be presenting the stock pitch for PTC Therapeutics today. PTC Therapeutics is a biopharmaceutical company, and my recommendation is to buy. As of March 20th, 2025, the current price is $56.63, and the target price will be $83.19, with a potential increase of about 47%. Now, before I get into anything, I want to talk about the industry for a little bit. Of course, a lot of investors avoid the biopharma industry because of its large rate of failure and the cost to produce any of the new drugs, and the time it takes is very hefty. However, it also can be a good investment because of its large market volume, its limited number of competitors, and the ability for companies to expand into this market is very high, as 95% of the 7,000 rare diseases do not have a therapy. That's why I believe the sector is worth investing in. Now, here are 6 of the primary reasons why. It's because PTC has a very strong foothold and a unique position in its disease market. It also uses successful strategies to mitigate the risks and also to guarantee revenues. They focus a lot on their pipeline, just getting the drug to the market, and they collaborate with big pharmaceutical companies so that they can alleviate the risks of failure and also guarantee some revenues. They have a very robust and comprehensive technology platform to address a variety of genetic disorders. They have 87 patents, and their clinical trial success rate is 42%, 3 times that of the industry average. They also have a high moat, which is a favorable competitive structure, being an oligopoly, and in addition to orphan drug designation and similar laws that grant market exclusivities of 7 up to 10 years, they can charge a premium price. Now, they also have some new products on the horizon, one for PKU, one for FA, that are expected to get approval in the 3rd quarter of 2025, and a phase 2 clinical trial of Huntington's disease in collaboration with Novartis. It is also something that I'll not talk about as much later, a defensive sector, and I believe it'll be a strategic investment, as most analysts believe that there's a 30 to 50% probability of recession in the US. Now, company overview, let's just take a look at it really quick. DMD, the DMD drugs and SMA drugs are their primary functioning income source right now. They have 100% market share for the AADC deficiency, which is one of the more recently approved drugs in the US and in the UK and US, with a long time before their expiration dates come to an end. And their pipeline, they got the PKU, the FA that are expected to get approval soon, and of course the Huntington's disease collaboration in 2nd phase clinical trial. Now, they have a lot of comprehensive technologies, but I will not be naming all of them. It's just they are very adaptive, and they address a lot of different issues. They're usually very fast to pick up on new technologies, and they balance high risk, high reward therapies with lower risk or small oral therapies usually. Now, the strategies, of course, they have all the strengths that come with being a steady biopharma company with a good R&D and high moat, robust pipeline. However, the most important thing are the opportunities. They collaborate with these giants to reduce the threats of regulatory hurdles and all the regular risks in the biopharma industry, such as failure of R&D, and they're also quite versatile with their technologies, and these new drugs will increase their financials significantly. They also do have weaknesses that I will talk about later in more specific detail. Now, of course, here is the collaboration I've been talking about for quite a while now. PTC Novartis collaboration for the PTC 518 Huntington's disease program. Novartis has already paid $1 billion non-refundable upfront and up to $1.9 billion in development and regulation, in addition to sales milestones. It is a 40-60 profit share with double-digit tiered royalties on non-US states after it hits the market. Now, for the financials, their financials and cash flow situations have been increasing very steadily and very well over the years. However, in 2024, we can see that it's taken quite a hit. This is due to the Committee of Human Medicine Products in Europe issuing a negative comment on Translarna, which is one of their more high-income products, and their expiration dates are also closing in, which is why their financials have gone down a little bit. However, this is just a one-time thing, and I believe that the new products, the PKU and the FA and the Huntington's disease, will all continue to make their cash flow and profitability much better. Here is the industry analysis now. It is a $100 billion market. the global rare disease biopharmaceutical market, of course. This is $170 billion in 2023 market volume, and it's expected to grow at a compound annual growth rate of 12%, up to $470 billion in 2032. There is also a high entry barrier, massive investment. New drugs to hit the market takes about 10 to 20 years, with a average cost of $1 to $3 billion. And that's not included with all the failures. It still has a higher chance to fail even if you spend all the time and all the money. And in addition to the fact, to accomplish any of these things, you also need very highly skilled specific workers. Now here's the porters. A lot of these are moderate to insignificant because of how big the market is. 95% untreated rare diseases, 7,000 of them known in the world, means that substitutes could appear, but they'll probably focus on other curable diseases, and the intensity of rivalry is also very small because of how many diseases there are and how few competitors there are in the first place because of how difficult this industry is to get into. The bargaining power for customers is quite moderate because although they can charge a premium price because there are very few other products, most of the customers buying are insurers who can argue back against the premium pricing a little bit. The most important thing here is the bargaining power of suppliers, which is moderate to significant because R&D for biopharma companies takes very specific materials which don't really have that many suppliers. Now, I believe you want to know more about some of the specific segments of PTC. Of course, the DMD and the SMA, they're primary income sources. They own about 25 to 35% of the market share, and for the AADC deficiency, they own 100%. As you can see, for a lot of these, there are very few incumbents, usually 3 to 4 max. And for the PKU and the FA, it's expected that they should be able to get about 20 to 30% of the market share as well. Now, the relative evaluation, I'll be using the PS ratio and the DCF ratio. PS ratio is used here because the PE ratio is sort of inaccurate with biopharma companies because they spend so much every year and are usually always in the negatives, and I don't think that's a very good valuation of their financials, or their valuation. And I'll also be using the PS ratios for the other companies to evaluate PTC, which comes out to about $83. And using historical data for the DCF model, we come up to about $90. And based on the principle of prudence, I will be taking the lesser price of 83. Now, for ESG considerations and risk analysis, of course, there's social responsibilities. They've always cared a lot about their employees and their patients. They collaborate with foundations such as the SMA Foundation of Europe and also Cure Duchenne to help lesser fortunate people pay off their therapies. Now, and for the governance, they have seven of the 9 board directors that are currently active are independent and they have no history of past corruption. And for the environment, they have very robust ESG reports, and in 2023 they reported that CO2 and waste recycled were about 58 and 59% respectively. Now, risk factors that come with almost every biopharma company in fact, are the substitutes, intensified competition from rivals, and the failure of NDA approval, which just eliminates or stalls one of their products, which can be very detrimental. However, the most important thing here for PTC is that they might fail to get Translarna sales permission renewed in the European Economic Area. Remember that one negative comment that might perhaps affect their sales renewal ability in the EEA, and they might no longer be able to sell this in Europe anymore, which might take a big hit out of their financials. Of course, the last thing is the AI impact. In 2024, some of you might know that the Nobel Prize for Physics and Chemistry was given to AI-related tools, and I believe the same thing will happen in biopharma, where AI will accelerate drug discovery and development and enhance clinical trials. AI is very good at analyzing, it's very good at organizing data, it's very good at making predictions. So it'll basically streamline a lot of the clinical trials and developmental stages of the new drugs, reducing the cost, reducing the time, and reducing the amount of skilled labor force needed for these things. Now, there are risks. AI, of course, is flawed, and a failed prediction that is not very well double-checked could potentially derail a pipeline, and it also poses some cybersecurity and ethical risks, as a lot of gene therapies require the patient's genetic data. And the last thing, of course, is that competitors can also use AI to streamline their drug R&D and clinical trials. That's it. Thank you.